Hi everyone, my name is Matt. I'm here back with the Change Healthcare Cyberattack in 2024, and this will be for GCU's Capstone and Cybersecurity Management Leadership 665. And this will be a company and incident overview, and then the solutions that were put into place, and then further solutions that could have been done as well. So to jump right into it, the company overview, we are, again, looking at the Change Healthcare cybersecurity attack. So Change Healthcare is a subsidiary of the United Health Group, which is a large health group, not only here in the United States, but around the world. Some reports state that they have 140 million people that they serve globally. Some are in the 200 million, served globally. What they do is they provide payment processing, claims management, health data exchange, pretty much anything with the healthcare industry, they have a foot in, they have a finger on. In 2025 alone, they were responsible for over $12 billion in profit. So they are no small feat. They are number 4 on the worldwide Fortune 500 companies. And so they are, again, no small feat. Their company goals are to help payers, providers, and consumers improve clinical and financial outcomes so that everyone in the healthcare system can thrive. It's a great feat to be able to do that. They believe that they are enhancing the healthcare system by transforming operational effectiveness and optimizing financial performance across the board. Again, 140 to 200 million people, that is a lot of help that you can do. But unfortunately, they were attacked. Just like every company out there is at risk of being attacked, they were actually attacked, and their fallout was huge. They were attacked by the ALPHV, or the Black Cat Group. They exploited some compromised credentials, and they did not have any MFA to prevent that from actually happening. A simple, here's a text code would have prevented all of this. The attackers actually were able to get in because of that, and they stole sensitive data before deploying ransomware. And then they, being Change Healthcare, they did shut down the system to try to prevent a larger breach. But the assumed Russian organization was already in. There's really no ifs, ands, or buts about it. Like I said, they were able to shut down the system, but they did find that malware, that ransomware, in their system after a little bit of time. So the timeline on this attack, it's kind of short-lived, but the fallout is much, much longer. We're still seeing the effects of it, and they're still paying the bill for it as well. So in February 21 of 24, that's when the attack was actually detected and the systems were taken offline. So there is no true date on when this started. This is just the first recognition of the attack, of them being have already been breached, and then the ransomware being found. Right. About 2 weeks later, in the start of March, Change Healthcare makes improvements to their system, and next day, pretty much ask Congress to get involved, just to help minimize the fallout. About a month later, the cybersecurity advisor for the AHA actually testifies in front of Congress to try to get this steam rolling, to try to get more and more support. Going forward, another 2 weeks. Again, this first timeline, pretty quick, about 2 months or so, about 2.5 months. There's more Senate hearings, and then they actually come up with a campaign to inform both media and congressional members about the challenges that they're still facing because of this attack. So we're already 2 months in, 2.5 months in, and they're still facing challenges about this. Mostly because they don't have any help to mitigate the fallout, but also because they created the fallout themselves by not having any good security to try to prevent this. 2 days later, a couple days later, in May, there's 2 hearings with United Health Group CEO, and they pretty much criticized the response to the attack because it was poor. The hospital perspective comes through loud and clear, and the lawmakers around this really, really, really got onto their case about it. Simply said, For what happened, it shouldn't have happened, and now you have millions and millions and millions of people affected because of it. So how big is this actually, affecting this entire situation? What is the impact of this attack, right? Short-term prescription processing and insurance claims were disrupted, worldwide. Any given point, they're serving 140 to 200 million people, and that just comes to a stop. That is outrageous, right? Hospitals, pharmacies, providers have operational delays. Now they can't put in those prescriptions. Now they can't see people. They can't pull the data. They can't log any more data. They can't log new stuff. They can't see the old stuff. They have no way to chart anything now. Approximately 190 people were affected by just this. Like I said, somewhere between 140 and 200 million people is the expected service population, and overall billions in recovery costs, right? Operations were compromised, cash flow was stopped because you can't bill anybody, can't do anything, can't take any payments. It's all come to abrupt, just no. Compliance and risk management, those costs are dramatically increased all of a sudden. No planning, no preparation, no crowdfunding, no executive leadership pushing the issue. It has to be figured out immediately now. And of course, legal compliance risk. That exposure was just astronomically blown up. And then they also have to be considerate of the possible litigation in not only multiple states, but multiple countries as well here. With serving 190 to 200 million people, that cost really adds up. If it's class action or not, that's a lot to be paid out. So what happened? What was the wrongdoing here, essentially, right? Of course, there's wrongdoing on both sides. The attackers are attacking. That's an illegal attack. Computer Fraud Abuse Act here in the United States, and then extortion and wire fraud. They did eventually pay the ransomware to have their systems back going, whether that was in the first week or whether it was that in before the congressional hearings. Nobody has an exact answer, but it was paid, unfortunately. And so, of course, a $12 billion company. Some reports said that somewhere between 500,000 Bitcoin and 2 or 3 million Bitcoin was the expected payout on this, which is a lot. Bitcoin has went up a ton over the years, and then to U.S. dollars, and then to wherever else. Like I said, it was a suspected Russian attack, but there's been no confirmation of where they actually are. And the company here at fault, of course, Change Healthcare. What did they potentially do? What did they not do? What did they do? Of course, they're healthcare, so the HIPAA security and privacy rules, high-tech breach notifications. They did not tell anyone that the attack had occurred until the campaign had started to inform the media and congressional members, right? To really bring up that support. I've had some technical difficulties here. So what could they have done? Pre-attack, right? Pre fallout. Just risk management, right? I'm sure it was something in place. It did not work. It fell through. There was a one-off that was found. Enterprise risk assessments need to be able to authenticate everything that they find, right? Those MFAs has to be part of the system. One text code saying, hey, let's verify who you are, could have prevented this entire thing, right? There was no MFA set up on that account. They were able to get into it. Here we are. Huge fallout. Just continuous risk monitoring with third-party companies. Put someone else in charge of it. Somebody that's going to be neutral and say, hey, this is what we see. Somebody from the outside in. Insider threats are always a liability, always a risk. But having somebody from the outside looking in is really where you're going to find the best analysis of what's going on. A company-wide process to identify and prioritize potential threats and vectors for attacks. Of course, and again, identify, analyze, and prioritize would be the three biggest things that this external company could do for anyone. And then, of course, board oversight. You have to have leadership on board, or nothing's going to happen, right? We can see these things happen all the time, but if those in charge are not going to be on board, it's not going to change. So again, what policies could be developed out of this? What should have been put into place already, right? Mandatory MFA. I've said it before in this PowerPoint, said it in previous ones as well. MFAs are annoying. They kind of slow everything down. Full transparency for myself, but they do the job, right? If again, one text message to say, hey, we're sending you a code, what's the 6 digits? Could have prevented all of this. Inactive users, that's essentially what this likely was just an inactive user, an inactive profile that did not have an MFA set up, and that's how they got into the system. They should have no access, right? If they've been fired, they've quit, properly or long-term, short-term, take away the access. There's no access, you can't log in, it's like the account doesn't exist, right? More secure MFAs should be put into place for every user, and with least privilege access controls. Only be able to access what you can. It's a large system. Healthcare is outrageous across the board. Somebody's going to have access to this. If there is a BOYD policy, bring your own device policy, gotta update it. It's either need to be updated or completely done away with. Provide the laptops, provide a cloud server, provide everything that your people need for this not to happen, right? Zero trust, IAM governments, security awareness. Let everybody know. If everybody doesn't know, then you're in the same boat and everybody is stuck again, and here we are facing these same issues. Then vendor risk management, of course, any kind of incident needs to be reported, recorded, and stored, logged. Anybody involved, everyone involved, every company involved needs to be recorded and then put up for safekeeping. This shouldn't happen any more than a handful of times, and it should never go as far as this either. To prevent the data breach side, downtime, supply chain failures, regulatory fines, etc. That's how you control your vendor risk management. One of the best things about this is that they did have a fairly rapid containment, right? United Healthcare, Change Healthcare, they did do a great job of containing what they found. It did take time to find it, but in a company that's large and number 4 on the Fortune 500, it's going to take some time to dig through this, to find what's going on, and to put a stop to it, right? You need tested incident response plans, backups, communication, forensic preservation, plans that aren't practiced, plans that are not ironed out, fall apart, right? Even the best teams practice, right? And I don't want to sound like Allen Iverson saying practice, but preach it, live it. If something comes down to it, you have a plan in place. It's been followed for years. It's been ironed out. Communicate everything to everyone. Everyone's on the same page. Everyone can prevent it. There's policies all around the world. It's a see something, say something policy, zero tolerance policies. It needs to be done. It needs to be done right. And then, of course, always coordinate with CISA, FBI, Health and Human Services, any effective partners, any parties, any vendors that have been affected by this as well. Always try to help what you can. You're in healthcare. They are clearly a for-profit business, but at the end of the day, it's making things right. And the end of this, which is they're still having the fallout for, needs to be exactly that. They need to make it right. And then just some general security frameworks that is being followed during this, but could have been definitely implemented a lot better. National Institute for the Standard of Technology. Just it lets them govern, identify, protect, detect, respond, recover, exactly everything that they've done, but they could have done it better, right? The Special Policy 800 -61R3, incident response. That's going to be your prioritization of what you need to do, right? And then the High Trust ISO 27001, just compliance. It's legal standards, it's minimums. Go above and beyond. Go above and beyond that. What does all this change? It's a framework. Continues to manage the regulatory response, and honestly, just it makes it smoother. And again, practice makes perfect, right? The last slide here is just references used in the presentation. You're welcome to pause, check, double check. Some of these may be outdated by the time that you're seeing this, maybe not. But feel free to reach out, and we'll work together and get them updated. Thanks.